How was WW1 wound triage performed? Have you ever wondered how soldiers received medical care during World War I? The process of wound triage was vital for saving lives on the battlefield. Let's break down how this system worked. Wound triage during World War I was a structured approach aimed at quickly assessing and managing injured soldiers. This process started right at the front lines and continued through to more advanced medical facilities. The first step involved stretcher bearers, known as brancardiers, who were responsible for evacuating wounded soldiers from the battlefield. They worked under the cover of darkness to avoid enemy fire. Their main goal was to move casualties swiftly but safely away from active combat zones. Once the soldiers reached nearby clearing stations, medical personnel took over. They applied dressings and conducted initial assessments to classify the wounds. This was crucial for determining which soldiers needed immediate evacuation. Surgery was usually avoided at this stage unless there was severe bleeding or critical injuries to the chest or abdomen. Moderately injured soldiers were often transported at night to minimize risks. The triage system sorted soldiers into categories based on the severity of their injuries. Categories included those wounded by bullets, those affected by gas, and other medical cases. This sorting helped direct casualties to the appropriate hospitals or field units. At the triage and field hospital level, the focus was on stabilizing the wounded. Medical staff prioritized managing shock, a life-threatening condition caused by severe blood loss or trauma. Treatments included removing wet clothing, warming the patient with blankets, and providing hot drinks and food. Morphine was administered for pain relief, and intravenous saline or blood transfusions were given when possible. Wound care was also essential. Medical teams performed debridement, which is the surgical removal of dead or contaminated tissue. They would then irrigate the wounds with antiseptic solutions like Dakin's solution. This mild antiseptic was developed during the war to help reduce bacterial infection in heavily contaminated wounds. Battlefield wounds were typically left open to prevent infection. Ambulance services played a critical role in transporting the wounded from clearing stations to hospitals further from the front lines. These ambulances often faced challenging conditions, navigating rough terrain while under threat of enemy fire. In summary, the wound triage system during World War I was a multi-tiered approach that combined rapid evacuation, careful assessment, and early wound management. This system was designed to improve survival rates amid the harsh realities of trench warfare. The methods developed during this time laid the groundwork for modern military trauma care, ensuring that soldiers received the best possible treatment under dire circumstances.